This is One on One. Hi, I'm Steve Adubato. Welcome to One on One. Today it's One on Two, and it is an incredible, amazing story that you're going to learn an awful lot from. Let me introduce the two gentlemen we have right here. Dr. James Klein is the Chief of Cardiothoracic Surgery, Englewood Hospital Medical Center, and his friend and colleague, Dr. Jeffrey Mitchell, attending cardiologist at Englewood Hospital Medical Center. Gentlemen, good to have you with us.
Thank you for having me.
Dr. Mitchell, what happened September 24th, 2012? You were playing tennis?
Yes, sir.
What happened?
I played tennis every Monday night at that time, and suddenly felt some chest discomfort. I didn't think much of it myself as a physician. I told my colleagues that I was playing tennis with that I would sit for a minute. They looked at me and said, "You're not sitting for a minute. We're taking you to the hospital." And I said, "No, just let me go home. Everything will be okay." And that's the last I remember.
That's the last.
At that moment, yes.
What happened to him, Doc?
So I actually got a phone call a few hours later. It was late at night. I was awoken, and was one of my surgical colleagues who said, Jeff Mitchell is in the emergency room with an aortic dissection.
An aortic dissection, which is?
Yep. So it's a fancy term for a tear in the aorta, which is the big blood vessel that comes out of the heart, which is a life-threatening event that, depending on where the tear originates, is often a surgical emergency.
And this guy wanted to go home. Look at you. What would have happened if he had gone home?
So Jeff had a type A aortic dissection, which means it originated right as the aorta exited the heart. And the mortality rate, the death rate for that, is about 1% per hour if left untreated. So in the first 24 hours, you'll lose a quarter of those patients. Those are just the people who get to the hospital.
So, you go to the hospital. Things happen quickly. You don't remember very much.
I remember what I was told, but I don't remember very much, no.
Okay. So, you guys knew each other.
Yes.
You worked together. He
Yes.
comes in with a team.
Yeah, a big team. Cardiac surgery team, a couple of surgeons, anesthesiologists, people who run the heart-lung machine, nursing staff.
How long
Big
was
team.
surgery?
About 16 hours.
Jeffrey actually had to go back to the operating room several hours after his life-saving operation for some bleeding. So the total amount of time is probably close to, 16 hours, with a short break in between trying to resuscitate him before we went back to finish.
Now, you all know it's him.
Yes.
Does it change anything about what you're doing?
No, for all the right reasons. If you are well-trained, well-prepared, ready, with a team that is well-trained, well-prepared, and ready, you are able to move past the emotional moment. You acknowledge it, but you have to come up on game day. And so, though there's definitely some emotion knowing it's a friend or a colleague, it's not the first time having to operate on a friend or a colleague. So you've got to put that away just for a moment.
Did your friends and colleagues save your life?
Yes, absolutely.
Do you have any doubt that if it hadn't happened the way it happened, you wouldn't be sitting here right now?
Correct. Well, yeah, I'm sure that's true. If I had gone home or I had some delay in getting to the hospital, I probably wouldn't be here. Or I'd be significantly compromised in many ways. For example, the longer this takes, besides dying immediately of some sudden event like this, complications like stroke, even heart attack, kidney failure, liver failure, et cetera, as it goes on longer and longer, the body can't tolerate that.
Describe the rehab.
Difficult. I was debilitated, cold, in pain, out of breath. Took a long time to recover.
How do you feel right now?
Essentially normal.
Essentially, operative word, or normal?
Normal. Normal.
You play tennis?
I've hit the tennis ball, but I haven't actually played a game.
No better, I'm sure. But
You got to give him a hard time.
we have a special relationship. Even before having to deal with surgery, we had one of those
Yes.
silly relationships.
Is it still a silly relationship?
I have the highest respect for Jimmy and the team.
How's your
obviously.
relationship changed?
Oh, I think we're still very good friends, colleagues, refer patients to each other
How has your relationship changed?
in terms of,
In terms of your relationship, given the fact that what happened happened the way it happened, how, if at all, has your relationship changed?
extreme thankfulness, sincerity, respect, emotional.
It is.
Yeah. Yeah.
How's your relationship changed with him? Other than the fact that you tease him about his tennis.
Yeah. So one of the things I know that patients struggle with after surviving big heart operations, two things I think come into play. One is people don't know how to express their thanks without feeling like they haven't expressed their thanks. And what I mean by that is I don't want Jeff or any other patient to carry that little bit of burden of indebtedness forever. It is okay to say thank you, and it is okay to show your appreciation, and then it is time to move on and get back to your life and get back to playing tennis, and not feeling like there's a part of you that always has to show appreciation. And the second is anxiety and depression are very, very common after big heart operations. Reflecting on what has happened, on your own potential mortality, and then the anxiety of, could this ever happen again, or am I really going to be okay the rest of the way? And we have had those talks. And
We have.
Is that real for you?
Yes, very
How
much
real?
so. Well, I think about it all the time. I was much more tuned into feeling exceptionally grateful to what they did, but I had to move on. I mean, after going through something like this, I had to get back to practice to make a living, functionally, medically, psychologically, and financially. And I've done that. It just took a long time. It takes a lot longer than you think.
What about the emotional and psychological part?
It's better, much better than it was. I was depressed for a while, clearly.
Interaction with your patients change at all?
Much more open in terms of what happened to me, because patients ask all the time. So I spent a good deal of 3 or 4 months to every one of my patients actually explaining what happened to me. Much more cautious and aggressive in treating hypertension.
You are?
Oh yeah, absolutely.
Wow.
You know, we used to let blood pressures of 130, 130, 140 even, and the elderly just kind of go by, not get so aggressive about it. But it becomes much more apparent that it's really important to
Got to
keep your
move.
blood pressure.
Got to do something.
Yes.
Advice to people watching right now who say, I'm feeling whatever, I go home. You say?
I say, don't go home. Get checked out.
Don't go home.
Don't take a chance.
Don't go home.
What Jeffrey said a moment or two about blood pressure, that is one of the biggest risks for aortic dissection, is uncontrolled high blood pressure, which is probably what happened to Dr. Mitchell. It's easy to ignore and easy to not want to go to the doctor and easy to be afraid of going to the doctor, but you can't ignore.
But gentlemen,
when
how
you're
do we
feeling
avoid
well.
having people be afraid of what we're saying right now and be alarmist in what we're doing as broadcasters? As broadcasters, how do I avoid that? How do we?
Well, we don't want to be alarmists.
So what are they on the lookout for?
So a routine checkup is a great way to start. You know, you're,
But he was in the middle of playing tennis.
Yeah, but I don't know how good of a patient he was before he got hit with a life-threatening event. I mean, I'm not so sure he went to his doctor twice a year for routine checkup.
Very true.
Did you?
No,
Oh, you did not.
I did not.
You weren't a great patient.
Well, it's hard to be a patient if you have no history. But Yes, I think doctors probably make the worst patients.
It's a fascinating story, and it's important that you've shared it, and I have a feeling you've helped a lot of people. And I
Thank you.
want to thank both of you for coming in.
Thank you.
Thank
And
you.
most importantly, we know you're going to keep doing better.
Yes, sir.
Thank you. Dr. Mitchell, Dr. Klein, and your colleagues at Englewood, thank you very much.
Thank you.
One-on-one, in this case, one-on-two. We'll continue right after this. Thanks.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey's credit unions, PSE&G, the New Jersey Education Association, Health Republic Insurance of New Jersey, the Healthcare Foundation of New Jersey, and by Celgene Corporation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.